Hello, my name's Sue Walters, and I'm here to share with you some learning from a Safeguarding Adult review, which is about learning from the life of a young man we'll call Louis. Louis was the victim of a wicked form of exploitation known as cuckooing. Now, at the moment, cuckooing is not yet a crime, which surprises many people. And although many nationally are in favour of pursuing a clearer legal framework to enable more accurate police enforcement, so to speak, national learning is that a multi-agency way of working would be preferable alongside enforcement. And findings from this review indicate that a similar approach is needed here, and also that a similar approach is needed to that of tackling domestic abuse, where many areas are using a public health approach and using an approach which combines multi-agency working. So what will we cover today? We're going to look at how Louis' life helps us to think about improvements in the safeguarding system. Cuckooing took everything from Louis, and we'll hear that his story wasn't shared across all the people and practitioners that were working with him. Most importantly, we will learn from Louis' life that the system itself has been broken, and that enabled Louis and possibly others to fall through the gap. We'll share the need for some improvements across the strategic boards, such as the Safeguarding Adult Boards and the Community Safety Partnership, and most importantly, what Louis' life helps us to think about in terms of improving the way we work together and the way we build relationships. What have we been asked to think about then? Firstly, unconscious bias. We talk so much about this, don't we? And Reading, in fact, has got some work in progress, and we'll be continuing that. Unconscious bias is so important to think about. As it says, it's unconscious. It's about the things that impact us, that affect the assumptions we make, and importantly in safeguarding, that potentially impact on the decisions we make on behalf of people and with people who are the most vulnerable in our communities. Also, we've been asked to think about what's available, what will help us to really think more about safeguarding people with care and support needs who are at risk of cuckooing. And the two are not exclusive, of course, because the people we see who are experiencing or at risk of cuckooing are people who are most likely to have care and support needs. The other thing we'll look at are some of the enforcement processes. For example, in Reading, as in nationally, something called closure orders are used, and the report goes into more detail about what these are. And these are used to protect people at risk of exploitation, people who are experiencing antisocial behaviour. It comes in different forms and different levels, from simply perhaps changing locks to moving people or to moving the perpetrators. So, who was Louis? Let's remind ourselves, and I just want to thank his family for taking the time to share about who he was. That was something that they really wanted to get over to you about him, that he had a story, that the Louis that people saw in the last year of his life was not the sum of everything about Louis. He was a sensitive child and sometimes obsessive, they said. He was actually born in England and the family moved to America and then moved to Wales. He saw himself as Welsh, and a number of times he spoke about moving back to Wales. Some learning from this review is that he did speak about that sometimes, and it might have been helpful when someone does that to really sit down and say, is this something that you really want? How can we make this happen for you? He was also a victim of domestic abuse, and his family say that he really struggled with this into adulthood. It affected his relationships. In fact, he did have a relationship in adulthood that was about coercive control that really did not help him, and his family felt that this made his struggles worse. There was drug use, which led to police contact and some criminality. There were serious life-threatening overdoses, and some of these, there was an accident as well, which left him in pain. He struggled basically with depression and anxiety. He was on a number of medications. At some point we know that he was homeless, probably about 5 years before he died, and he moved into the flat which he would stay in until he died. Sometime around that point of homelessness, when he was in supported accommodation, he met the man and his partner who would later exploit him, who would move into his home, and he saw it as his home. He spoke to his family when he first moved in. He was very proud of it, and they would take over his finances. It seems clear, with the benefit of hindsight as well, that Louis was seen differently and described differently depending on whether you spoke to him over the phone, whether you saw him infrequently, or whether you actually saw him face to face. The main people who saw Louis face to face were the housing officers and the neighbourhood police. And there was some considerable good practice there, in that they recognised on a number of occasions that this was possibly cuckooing. They described how terrified Louis looked. They put in safeguarding referrals because they were so worried about him. They were more likely to describe him as sensitive, vulnerable, and scared. Others who didn't see him at all were more likely to say that he was prone to lying, that he was difficult, that he didn't want to engage. And in fact, he did say to mental health services that he didn't want to be seen at face-to-face appointments. However, we do need to challenge ourselves, don't we? That when that happens and yet someone says to you that they're feeling more isolated, that they're feeling low, that they're having to lock themselves in their bedroom because they're scared, might that prompt some different thinking? So let's think about cuckooing. Let's just remind ourselves. I've used the word coercion and controlling. I'll also use the word intimidating. And this is what was happening for Louis. This was his reality, if you like. It was a place, a practice, as it says here, where people take over a person's home. And what we don't know is the full extent of this happening in Reading. There is no real data yet, and this is one of the recommendations of this review, to get underneath that, to look at who is at risk of cuckooing and who is experiencing it. As we say, how many more? And in the Community Safety Partnership, there are a number of meetings take place for people who experience antisocial behaviour or who are perpetrating antisocial behaviour. How many of those are experiencing cuckooing? How many of those are also victims? And his family want you to know these quotes. They want to ask the question of why so many vulnerable people were put into one type of accommodation without the support that they might have had in previous homeless accommodation. How are their support needs passed on? For example, they want you to know. How are they shared between different housing officers? How is that information shared? And one statement that the family said, which was quite poignant really, is, how come nobody spoke to one another? And we challenge ourselves with that very question, don't we? So what was happening to Louis? Here we see parallel processes happening. And of course, This was a very different system to how it is now. Now there were some improvements and changes taking place. However, the good practice by the police and housing in terms of safeguarding referrals didn't work for a number of reasons. At the first point of contact, the front door of social care safeguarding was not a social worker. The decisions were not made at that point by a social worker. That has changed. Consequently, the referrals were not pursued and they were closed, and it was said that Louis did not have care and support needs and did not meet the criteria for the threshold under the Care Act. We know now that that is unlikely, that in fact he had some serious and significant risks. Now, of course, there is a social worker there and decisions are changed. Just before he died, though, there was a safeguarding referral that was accepted. However, it didn't get to a strategy meeting and he sadly died before that point. So because the previous safeguarding referrals were being closed, there was no strategy meeting, therefore no discussion with health partners or others, no sitting down together to discuss what was happening, no information gathering and sharing. Therefore, the mental health team, as you'll see on this slide at the bottom, and the GP were not aware that there had been concerns about cuckooing. They were not aware that there had been a number of call-outs and how scared Louis was. They were not aware of the change in his appearance, of how he looked, of how terrified he looked, of how he was beginning to look unkempt. And this is something that his family also wanted to get over. They said he was someone who was very neat, who looked after himself, and this change in his behaviour, in how he looked, was not like him. Here we begin to see then the telltale signs perhaps of a broken system. This phrase was used by a number of people during this review. What does that mean? It means that we can see there was, for example, no guidance on cuckooing or data available. Now, the lack of guidance led to some variable responses. No consistent approach in terms of what was pushed forward as safeguarding, if you like, and what wasn't. What was considered about closure orders and what wasn't. So although there was good practice, it wasn't always consistent. The other thing that signifies a broken system is the difficulties in relationships. Now, there are no sort of difficult relationships, so to speak, but the lack of face-to-face contact is so important to be able to see what's happening. And then, of course, when you see what's happening, to actually pick up the phone to someone or make contact with someone else and say, I'm really worried about Louis, could we have a chat? So relationships matter, policies matter, guidance matters, but relationships are key. Without them, without that relational activity, all the rest will fall on the wayside. The Mental Health Trust didn't oversee the clinicians' work at the time, and that now has changed. And therefore, there were no patterns being spotted, and he wasn't, as I've said, being seen at all face to face. Another significant indicator of a broken system is the statutory adult safeguarding. The core piece of safeguarding in Reading, the multi-agency framework itself, was not working because the decision-making process wasn't right. Now that has significantly changed, but still needs lots more support to embed. A key point to notice, and a question that I will pose to people, is what does it tell us about a system when safeguarding referrals are closed and there is no challenge? There is no further discussion. There is just an acceptance that that's not going to happen. What does it tell us when there was a fundamental flaw, if you like, at the core of safeguarding in Reading, and yet this wasn't noticed or highlighted until new leaders came into post, in fact, and there's some really great work happening. So the simple facts are, as I've said earlier, no full understanding of cuckooing, no knowledge of its prevalence, no multi-agency discussion or strategy meetings, and no links. Why then is the reliability of safeguarding in question? What does it matter? What we see is a pattern of working based on this is the way we do things here. The inextricable link between culture, leadership, and safeguarding once again. We see that meetings have evolved, such as the antisocial behaviour complex meetings that take place under the guidance of the Community Safety Partnership, which are good. It's good that they happen. It's good that lots of meetings happen in our systems. However, it's the outcome of those meetings, it's their effectiveness. And in this case, those meetings don't fully address the vulnerabilities of people being talked about at them. It doesn't really get to the point of who is at risk of cuckooing, which of those people being discussed has such complex needs that they need a different approach, that it's not just about enforcement and antisocial behaviour, that it's about both. Again, the numbers of strategic boards that we now have in all our systems is complex, and each has their own way of doing things. And as I've said earlier, some of the same people sit on the different groups. And there is, as I've said, a multi-agency safeguarding framework in place, and yet in this case, it didn't work. And the key statutory partners were not working as one. But improvements are coming, and there are complete changes within the adult safeguarding team. There's different reporting. Cuckooing is a subcategory now. And the Mental Health Trust have a really good way of working called One Team, and have put in supervision and oversight, and the requirement to see people face to face. And also learning from Louis is that people with emotionally unstable personality disorder, which is a diagnosis given to Louis, that they actually would be best on another pathway, not the outpatient pathway that Louis was on, but actually on a pathway which would help more therapeutically. And the police, TVP, have a subcategory now on their recording system and are reviewing the way that they work. Here's the complexity of the system at work. We see a system that is separate. All these different agencies, all different people, all around Louis, to the point that he was there but isolated more and more, in plain sight but not really seen, a semblance of working well together, and yet it doesn't go deep enough. But as I've said, changes are taking place. So often we see this in safeguarding reviews, don't we? We see the number of people, but we see that the overall safeguarding system, the core function, if you like, wasn't working. And relationships matter at every level. We've spoken about some of these areas. We've spoken about some of the challenges and what we've seen and heard and how this impacts on the system. Crucially, relationships matter at every level. Protocols and processes, of course, matter, but the activity of getting to know each other is what matters crucially. And there must be greater links between the Community Safety Partnership and the Safeguarding Adult Board, plus that greater understanding of cuckooing. And initially, some digging and scoping about what exactly is the need. And this is the learning from other areas which are already moving around multi-agency teams and pathways around cuckooing and exploitation, joining things together. And what they said is, yes, have your policies, have that. First of all, get the data though. look at what the need is, and before you get toolkits in place, do that bit of work first, and then get the toolkits. And involve those people who are experiencing or have experienced cuckooing as well. Get their view. See what would help, what didn't help. The things that we all know about in public health work and approaches. So services are making improvements, and yet they still need time. There must be no assumptions made. We must recognise that there is unconscious bias happening. And Reading is doing work already on this and will be continuing. Alongside this, of course, is the need to think about the trauma-informed approach. A thread running through this, which is spoken of more in the report, is that we need to work in a certain way, don't we? But trauma-informed approaches and trauma-aware approaches are really about the system working together as well. It needs to be a systemic model. It can't just be one agency taking this on. And here we see learning from another SAR, in that here, professionals who were sensitive normally, who come to work to do a great job, fail to respond with compassion and understanding because of the environments around them and what was happening. And here, in Louis' case, we see a perfect storm in Reading at the time, with the core issues in the safeguarding team at social care, with no real decision maker at the time, the lack of strategy meetings, the way that agencies didn't speak together, the fact that there were relationships, but they weren't relational. And most importantly, the impact of unconscious bias extends to these characteristics. This is what's happening. This is what happened with Louis. And this, in fact, is learning nationally. This phrase, not the ideal victim, is a phrase that's used in some national research to do with the National Cuckooing Network. This means that someone like Louis might not be seen as the victim because he had criminality. In his case, he was also Welsh speaking, and his family wanted that to be kept in because they felt that might have impact. Who knows? The fact he was a drug user, the fact he had this diagnosis, which we know leads sometimes to some bias, as we've said earlier. So what do we need to think about now? The system in Reading is restoring itself. It is beginning to improve, and yet more work needs to be done to move things forward. Work is already happening, and there's already work across the different strategic boards to think about how you can work more collaboratively together, to think what needs to be different. What do we need to remind ourselves of? What do we need to think about? Yes, we can have policies. It's so good to be on these different boards. However, we need to remember why we are here, to turn upside down everything that we think. And in fact, the learning from best practice, such as in Nottingham, is that sometimes we need to step out a little bit of our own professional boundaries and put the person in the centre to truly be agencies and system that makes safeguarding personal. And perhaps we need to revisit that more in all of our practice. What does making safeguarding personal mean to us in reality? So here's what's happening. There is no agreed process yet for cuckooing across Reading, but let's talk about it. And what was happening was that those strategic system-wide structures didn't enable practitioners, if you like, to do what was required. Improvements are not yet business as usual, and that's what we need to remember as well. Although it's restoring, it needs to be business as usual, and until it is, it needs a lot of support. Everyone needs to play their part in helping to tackle exploitation and cuckooing. Stronger multi-agency working arrangements. How often do we hear that? How often do we know we want to do it? We're so keen to do it, and yet things stop us. But now this is a turning point. This system, which people have acknowledged has been broken, is now beginning to restore. It would be good to explore those national contacts. And the Safeguarding Adult Board Business Manager is sitting on a national group now looking at cuckooing, and that will be so important. Still needs to be made and gained. Audits will be required, for example, some real hard work to bring people together. Explore the best examples that are out there, and the report does talk about more of these, but also think laterally. Think about public health approaches, community development approaches, the innovation network, for example, principles around domestic abuse, and remember the person at the centre. Learning from best practice nationally is also, as I've said, about thinking laterally. Think about how domestic abuse is tackled and the public health approach which is being developed in places like Hull, for example, Nottingham, and a number of other places where they're developing an approach called the CCR model. This is what you might want to think about in the meantime. Do your staff know what to look for? And this sits in some of the toolkits. But as I've said earlier, the toolkits are not everything. More work needs to be done first. Some baseline work needs to happen. And remember, it's not either or. Yes, of course, there does need to be some enforcement. But sometimes that means that victims are held responsible and there's confusion about who's victim and who's perpetrator. And if we want to see real change, we need to think more clearly about that. So the big question is, how will you as a system, how will you as different agencies maintain engagement with people who are victims of crime and also engaging crime, are being exploited and sometimes may exploit, but are at risk of harm? And sometimes, like Louis, don't see themselves as victims and will, of course, present sometimes as difficult. They've had experiences with services. There are all sorts of things going on for them. And what now is the real potential to get this strategy, to get thinking about the whole process? Is there an opportunity to remind ourselves of making safeguarding personal? And what assumptions, what's your thinking that stops you and the people that you work with or the people that you manage, that is preventing you from working and hearing people's voice? Think about how you respond. Take advantage of anything that's going on around unconscious bias. Think about supervision and reflection. How might you challenge yourself and your thoughts? But what if there was a simpler way? What if we're making this all too complicated? What if we simply work together to tackle exploitation and cuckooing? What if we simply put everything aside and said, what exactly needs to happen? What if everyone who attended those meetings at the Community Safety Partnership, for example, were the right people? What if the process was just simple and clear with an easy referral process? What if we were prepared to stand up and say, I don't like the way things are, we need to put this aside and do it differently? What if in a year's time we looked back and we saw that the system was safeguarding the most vulnerable in all these 5 areas on this slide? What if we were confident in a year's time? What would we be doing differently? What would we be sitting here to say in a year's time? We have all these recommendations and I believe in them. I believe we need a protocol. We need balance with enforcement and safeguarding. We need the data. We need the improvements to take shape and continue to be supported.